Now I know you guys are watching videos about nasogastric tubes, but I just wanted to give you a few little tidbits. Sometimes they skip over some details when they do the skill videos. But the nasogastric tube we're talking about this semester is a very tiny, thin one that's inserted through the nair in the nose and goes all the way down into the stomach. In order to check placement after it's initially placed, there is something inside here called a guide wire. And that wire, and I'm going to try to show you, I don't know if you'll be able to see it, this blue cap that's on the end of a brand new nasogastric tube. When I pull it out, there's a wire. Oops, I gotta unwrap it. And that will come all the way out. I'm actually going to take it out now because I'm going to pretend it's in the patient. We leave the guide wire in when it's first inserted because that guide wire is what shows up on an x-ray. So after the patient has a brand new NG tube inserted, they have to have an x-ray done to make sure the tip of it is actually in the stomach. Okay, and when you watch the skill video, it'll talk about the markings. There are markings for measurement on here on how they insert it. But I just wanted you to know that there's a guide wire in there. It comes out when we're ready to use it. As far as using a nasogastric tube, we're going to use it the same way we're going to use a gastric tube, a G tube. We're going to be using it to administer medications. We're going to administer enteral feeding, which is also called tube feeding. These feeding tubes come with very small ports on the end, but luckily they come with a nice adapter that'll make it larger because I'm actually going to use the syringe from my irrigation kit, and if I try to put this together, it's just not going to happen. They're two different sizes. So we have this little adapter that you can pop into place, and it goes in the end of the tube, and then your big irrigation syringe will fit in there. Okay, so that's what that's for. They often have two ports, so I just want to warn you. If you see this, it's looks like a Y. So we've got our little adapter we're going to put to use our syringe, but then there's a second port, and if you don't close the plug on it, be warned, when you start pushing stuff through this hole, it's going to come back out this hole. So just watch for these little plugs. There is a plug on the side of this one, the adapter, that you can plug the main hole because you may not be using it all the time. It might not be connected to things, so you want to make sure those plugs are attached.